What we all want is people to age healthily in place, not just to age in place. So if we're not building places and spaces for people to have choice, then we are restricting the ability of people to exercise what is, I think, a fundamental human right to choose where you live.
Welcome to Coming of Age, a podcast that is changing the conversation on aging. I'm your host, Donna Duncan, CEO of the Ontario Long-Term Care Association. This season, Season 4 of Coming of Age, we welcome an exciting roster of guests from around the world, thought leaders who are at the forefront of transforming seniors' living and care and are shaping the future for all of us as we age. Today, we're exploring the evolving landscape of aging and social care in the United Kingdom. In a world that's becoming more interconnected, there's a growing global conversation about how we can work together to meet the needs of our growing population of seniors. Conversations like the one we're having today are part of that global dialogue where we are connecting across systems, embracing technology, and pushing for more flexible, forward-looking approaches to reimagine what aging and social care can look like. Joining us today are two inspiring leaders, both of whom I have the privilege of working with on the board of the Global Aging Network. First, Professor Vic Rayner, CEO of the National Care Forum, representing more than 170 not-for-profit organizations providing high-quality social care and support across the United Kingdom. Vic's extensive experience spans social care, health, housing, and technology. Vic also chairs the board of the Global Aging Network, collaborating internationally and leading on innovation and change. And we are joined by Dr. Donald McCaskill, CEO of Scottish Care, a leading voice for the independent care sector in Scotland, which includes care homes and home care organizations. Donald also hosts a weekly podcast based on his weekly blog, sharing his perspectives informed by decades of leadership and expertise in health, social care, and human rights. He's also leading conversations on issues such as bereavement, palliative care, and also on AI and new technologies in social care. Let's dive in. This episode was generously sponsored by our sector champion, Point Click Care. So welcome back to our listeners. It is such a privilege to be joined by Professor Vic Rayner, CEO of the UK's National Care Forum, and Dr. Donald McCaskill, CEO of Scottish Care. Today, we want to do a level set about the prevailing trends in aging and social care in the United Kingdom. And it would be really helpful for our visitors if you could touch on how you define social care for older adults and if there are any areas of overlap with long-term care.
Thank you very much, Donna, for inviting me to come and join you. It's great, a real privilege to do that. So social care is a very complicated term in the United Kingdom, I would suggest, because it covers a whole range of service models. But because we're talking about long-term care and aging, a very helpful sort of focus for me is thinking about social care as being a range of different services that enable people to live as independently as possible. And there's a really interesting organisation in the UK called Social Care Future, which focuses on social care as being about people being able to live the life that they want, surrounded by the people that they love in a place that they call home. And that could be in a range of residential settings or places that are away from their family home, or could be within their family home. But for me, it's absolutely about enabling and providing support for people to have the best quality and the most independent life that they can.
I would agree with everything that Vic said. Sometimes we hear the phrase being used, health and care. And I react against that phrase because, for instance, aged care, I think it's profoundly significant that we use the term social in front of care. because it reminds us that independence isn't about isolation. It's about how do you enable somebody to be and play their full part as a member of the community, a citizen of the nation. So philosophically in Scotland, we've always emphasised that somebody is enabled to be independent, but to be fully part of the community in aged care, regardless of where they happen to live. And secondly, that social care is not just about the services and supports, which we might consider to be traditionally aged care. It's about all support in a community, which enables people to belong. So it's about well-being. It's not just about maintaining people. It's about enabling those individuals to flourish and thrive until the end of their life.
In Canada, we talk a lot about aging in place, and we talk about it in a very narrow way. It's about people aging in their family home. And the polling says, and everybody seems to want to stay, their plan is to stay in their family home. And I'm really curious about how do we move governments to support perhaps a broader definition of how we define home? Because what we're finding is our politicians are saying, well, everybody wants to stay at home, so we're just not going to build out other services. And whether those are community mental health supports, other social supports within the local community, including long-term care, which we would argue is part of the aging continuum. From your perspectives, what are those key responsibilities of political leaders, as well as I would say society, in building a better future for seniors, but taking a broader view of what it is to age?
I mean, just in England, if I talk a bit about, so people might know some of the political responsibilities are split across the different nations that make up the United Kingdom. So in England, I'll talk a little bit about what's happening there. So we have a very explicit, we've just changed government, but the policy in a sense has remained intention to promote something which is called Home First. So this idea that exactly as you say, Donna, people will be able to remain within their own home for as long as they wish, and that care will be provided to them there, that technology particularly might play a bigger part in terms of how people can remain independently at home. People's choice and preference is geared around staying within their family home. The challenge for some of this, and I guess this is where your political point comes in, is certainly in England, and my guess is in Scotland, but Donald will say, I mean, we have the housing stock in England is very old. And actually, there are large swathes of housing that are really inappropriate for people to continue to live in, and certainly to continue to age in. So there are 3.5 million what are called non-decent homes in England, and half of them are headed by someone over the age of 55, where people are renting in a private rented sector. 2 in 5 of those pension age adults were seen to be in relative poverty. And we have a growing global majority or Black, Asian and minority ethnic background cohort of people who are aging in England. And 1 in 5 of those over 50 are living in housing deprivation. And of course, there's lots of challenges about people being able to heat their homes appropriately, etc. So there is a big challenge, I think, that isn't being acknowledged in this discussion. Often the narratives around people going home from hospital rather than going into long-term care, or people remaining in home rather than going into long-term care. But we're not having the same discussion about whether that housing that they're in is appropriate or otherwise. And I think to your point about a continuum, we certainly see that is absolutely necessary in England to have a real range of provision and some absolute choices for people. I think what we're beginning to see, because of the economic pressures faced across the UK, is that choice is becoming less and less a reality for people. And actually, what we need often for people when they do need long-term care is really specialist nursing and specialist dementia provision. But the ability to both attract and pay staff at the level that is needed to deliver that is not seen to be the political priority that needs to be for that real and meaningful choice to be available.
And is it the same in Scotland, Donald, or do you have a similar experience?
We have housing that's not fit for purpose. We also have the huge issues of remoteness and rurality, which parts of England have as well, but you could multiply by 10 the particular challenges. So the majority of Scotland's population live in only 10% of the landmass. Many other individuals live in what is possibly known as the picture postcard, the Highlands, the beautiful countryside, but isolated in many senses. So what does it mean to age well in place in a rural community with very little infrastructure of support, difficulty in recruiting staff, difficulty in attracting investment? That's a very different question than what it means to age in place in an urban or a small town environment where there is a greater access to staff and opportunities and flexibility. So I think it's important that our politicians address the sort of issues around housing, around availability that Vic has highlighted, but also begin to understand what we all want is people to age healthfully in place, not just to age in place. And that removal of choice where you don't get the opportunity to exercise choice because provision isn't established is a real worry. So if we're not building places and spaces for people to have choice, then we are restricting the ability of people to exercise what is, I think, a fundamental human right to choose where you live, with whom do you live. And what we are increasingly seeing is that those who can afford to pay are electing to move into small communities. People are living longer. They're not wanting to live lonelier lives. And so when significant members of their family and networks die or simply move away, many more people who can afford it are moving into small residential environments. I think most of us would agree that the day of large physical, almost hospital-like residential and nursing establishments should be in the past. But how do we enable communities to be created around people who want to live collectively? That's one of our challenges. And we don't have either a design world or a political world which is moving in that direction of small supports.
This is an issue that we experience in Canada. So City of Toronto has lots of supports. We're seeing naturally occurring retirement communities emerge out of high-rise buildings, rental housing. We're seeing sort of a natural aging communities really coming to the fore. What we're not seeing in our rural communities is any kind of solution for how do we support people in those rural communities where there may be no other social supports. The individuals who are living there are the people who built their communities. So you've spoken about small housing. Are there other considerations for those small rural communities?
I think there is a danger in aged care or social care that we seek a one-size-fits-all solution to our particular challenges. So what's going to work in an inner city where space is a premium and people create vertical communities is not going to work in a rural and remote areas. So I think as well as focusing on the built environment, which is probably easier in a rural community, we have to address the particular challenges such as workforce recruitment and retention. How do you attract people in and incentivize living in remote and rural areas? Now, post-COVID, we've certainly seen in Scotland a lot more people wanting to move out of the cities into remote or rural areas. That, I think, would be even greater if we were able to, and governments were able to economically incentivize that. We have in the UK something called a London weighting, which recognises that you've got to increase salaries, you've got to increase the cost of opportunity to enable you to attract people to a city like London. I would like to see a rural and remote weighting. So governments deliberately spend more money in rural communities. Secondly, I think we need to change the way we regulate in rural and remote services. So I've been speaking and hearing from colleagues who are exploring the option of accrediting not services, but actually accrediting a worker to work across a range of services. So an early year worker who can then use her skills to work in adult services and learning disability and older people services. We need to look at housing for people. A big issue in rural communities is you can get the job, but you can't get a house because most of the accommodation is bought up by tourists who only live there for 2 months of the year. Transport's another major issue. Why don't we offer free transport to individuals who've got specific roles to maintain the fabric of a community? Scotland's not the only country facing rural depopulation. Social care can be a driver of economic repopulation if we allow it and have the policies in place to allow it to be like that. Because what better than to live and work and grow old and die in the community which is yours?
That's certainly something that we've been talking a lot about here. We're talking about northern and rural grants. They provide them in other sectors in Canada. So especially higher education for colleges, universities, for hospitals, but they don't provide them for seniors care or seniors living or social care at all. So it is something that we've been advocating for in Ontario and across Canada as we try to find different solutions. You touched on the workforce element, and I know that this is a big topic for the Global Aging Network. And Vic, you're our chair. I really want to thank you for your leadership with the Global Aging Network. I think what's really clear from our discussions is we are all grappling with the same issues. I am wondering, what are some of the challenges or opportunities for building a new workforce, both our own, but also thinking about how we compete, how we are competing or should be competing, if at all, for the workforce of the future? And I'm curious, Vic, from your vantage point, what you're seeing and hearing, just given your depth of experience on the file.
I think that there is a real challenge about the workforce, as you rightly say. So we continue to have a shrinking domestic workforce, so UK-born workforce. And whilst the workforce as a whole in England has grown, a large amount of that has been through international recruitment. And it is hugely welcome, and the skills and expertise that are coming into the UK through that international workforce are absolutely necessary and recognised. I think what the shrinking domestic workforce tells us is we've not yet got that right, the story right, and the pay and conditions right to make it a meaningful career. In England, I think only 8% of our overall workforce, only 8% are under 25. It's a significantly aging workforce. So we've got large numbers of people, particularly in leadership roles, who are 55 and over. What was really useful at the Global Aging Network was firstly to recognise that the UK is absolutely not alone in this. And one of the sad realities does appear to be that, firstly, we're not alone in terms of how difficult it is to recruit and retain people within this workforce, but also that many countries around the world don't properly value the skills and expertise of care workers.
Donald, you spoke about accrediting workers across services. So thinking more broadly about how we use the existing workforce that we have. You talked about key worker housing. You talked about transportation. On one of our earlier podcasts, we had the privilege of speaking with Katie Smith-Sloan and her colleague from the SCAN Foundation about work that's happening in the United States around cross-sector planning. Are you seeing, Donald, anywhere in Scotland, someone who started, whether or not they call it that, but are communities actually starting to do this kind of more creative planning around as they think about what are the more holistic needs for those local communities in aging?
We are beginning to see the birth pangs more than anything else about people recognizing that we've got to do things. One was that we've got to recognize that the workforce of tomorrow is not going to be the workforce of today. They are a different creature. Generation Z is going to make demands and have expectations of what the workplace is going to be, which might be completely the opposite of some of those of us who are listening to this call who may be over the age of 50. I'm not even safe whether you're a baby boomer or not. So we've got to say to ourselves, right, do we just accept that that's a lost generation to us? Or do we change the way in which we support workers, the way in which we deploy, the way in which we have patterns of work, to keep the essence of good care and support, which is about continuity, relationship, familiarity, trust, to retain all that and actually to celebrate what is distinctive about care. I think we need to be less apologetic about how gloriously wonderful the job of care and support is. We've got loads of university research now to show that it's for the individual psychologically and physiologically beneficial. If you care for somebody, you actually live longer than somebody who does not engage in the activity and the actions of care. It benefits you psychologically. We have got to package the job of care and support in such a way that it makes it attractive to a new generation, but also we've got to recognize the fundamentals. You can package a gift as much as you like, but if it's empty inside, it's going to be empty inside. So we've got to reward, remunerate, and recognize. And that's down to our political leadership. So we can do all the innovative work to attract a new generation, to hold on to our existing workforce. But fundamentally, as societies, we've got to ask ourselves, what do we value the most? Do we value human services greater than, for instance, manufacturing, fiscal services? Because economically, social care is, or aged care, or care of children and adults, is an economic driver in all our communities, regardless of where we are in the world. But we don't use that language of economic contribution. We always talk about cost, drain, and deficit. We need to change the narrative, stop being so apologetic, and reform our systems so that they attract rather than dissuade.
I was just going to add, I think, to Donald's point about the generational change, we really have to acknowledge that the work that is being done now will not be the same work in quite possibly 3 to 5 years' time. And I think we haven't talked about technology, but that clearly is something that is a massive game changer, certainly in the context of international workers being able to utilize digital care records, which have translation functions, for example, and allow you to do speech to text. That is a massive game changer, really, in terms of people's willingness and ability to deliver care in different countries, but also the role of technology in terms of supporting and carrying out some of the functions that we don't need people to be delivering. And back to your rural discussion, I was recently in Norway, where, a bit like Scotland and Canada, there are large areas of rurality. I was hearing about technology both in Norway and in Sweden, actually, which recognizes that you can't, if you are going to enable a home first approach where you're going to discharge people from a hospital or out from a long-term care setting back into their home. And you want a home care worker to be there potentially even before they've got home themselves, ideally before they've got home themselves, to make sure everything's right and correct. But it's not, we're so used to that now not being the way here. But then, you can utilize technology like latchkey technology that enables any home care agency in the locality they can receive the code that will enable them to access the individual's property and go in and help and provide the care. And of course, that means then you know when somebody's been in, how long they've been there. That there's a whole range of things that make it undeliverable that I think we should be thinking about. And actually, for the care workers, mean that they have a more enjoyable and productive working environment, rather than what we currently have, certainly in England, and I suspect still in Scotland, care workers who have been commissioned by the local authority to deliver care for 5 to 10 people in a day, but they're spread all over the countryside, and so they're spending large chunks of their time and going around in between jobs rather than doing something much more productive that responds to the needs of the day. I think technology is going to really transform the experience of people doing care work. And that's something, so we have to plan for that as well. And we have to think very quickly about what we want to change.
So to that point, because I do think it's a very important one, and we recently had someone from the Vector Institute from the University of Toronto talking about how they are running pilots across Ontario and Canada for things like remote monitoring, but everything's a pilot, nothing's getting scaled. So we've got those initiatives that are being seeded but not scaled. The cost of a wearable instead of the cost of a hospital stay is actually far more economical. But we also are seeing family members doing this on their own. So whether they're buying an Apple Tag or an Apple Watch for their parent to monitor their activity levels, they're using Ring cameras on the doors to monitor who's coming in and out. There's all of this new technology that individuals outside of the system are taking advantage of. And it's almost as if you've got government kind of stuck. How do we get them to move? And Donald, even as you think about the accreditation of professionals, imagine if we just tried to figure out what the art of the possible was. I do believe that there's a point at which the public is going to become more intolerant and wanting to do more.
Yeah. So if the workforce of the future is going to be different, and Vic is absolutely right, it will be a workforce more comfortable and more desirous of using technology. So the care and support, or aged care or social care, needs to change as well. And I hope the general public becomes more intolerant, not just of government, but of what is offered to them. And the biggest area of potential is in preventative care and support. So all those wearables, all those Internet of Things devices that we see, the Alexa, the Google Dot, and I don't want to exclude anybody. I'd have to, spend the rest of the podcast naming all the devices. They're about enabling people to have greater control, choice, and voice in their own lives, never mind in their care and support. So what I think we are trying to do through a program which Vic knows and Donna, called the Care Technologists, is to use people's technology in their own home so that the care and support person becomes an enabler of that person's independence for longer and can call upon a specialist intervention. If somebody's dehydrating and there's evidence of that, if somebody's not moving consistently well, if there's early indicators of issues around breathing or heart monitoring, etc. So the devices are there not to replace human presence, but to enhance that presence. And that's the care of the future. It's the care of the now. It's happening now. And we need a workforce that's confident, as Vic said, in the use of technologies, but not just in their use, but in their preventative use and support. And we're moving in that direction. I think we need regulators and governments sometimes to get out of the way and let the flowers flourish. Take the weeds, of which they are some, and get out of the way. But I think we also at the same time have to be cautious that we don't abandon people, because there will be a significant number of individuals who experience digital poverty. And that can either be because of economic poverty, but more often it's because of the poverty of accessibility. So much of our current technology is not suitable for people with visual impairment. And 80% of those over 80 have a visual impairment. So much is not suitable for people with oral challenges, and indeed those who may have difficulty with dexterity. So the challenge to the tech sector is to create devices which enable people to continue to use technology for longer. And that's, all very well Elon Musk and others getting us ready for the new planet, but actually growing older in this existing planet would be much more preferable.
And Vic, do you have any examples from England in terms of initiatives that are testing the boundaries of technology?
There's an interesting article actually looking at it just this weekend, which was the first time I've really seen a sort of major newspaper pick up on technologies that have been used in the long-term care sector. And they were things like acoustic monitoring, sensor-based tech within rooms, things like use of circadian rhythm lighting to support people in the context of their mood. There's also digital care records. I think the challenge is to understand how, a bit like you, we move from pilots to long-term adoption. And I'm not very keen on getting government out of the way, in that I think that they have a real role to play in terms of setting pathways. So where we've seen really successful embedded adoption of technology in other countries, I think it has often been led by a government initiative. But I think the idea that this is a discussion with citizens and with communities about how they want what care to be delivered in the future can't be a discussion that happens without government in a way. We are probably the most highly regulated of any sector in the country. So, the regulator, whilst we might think that they are not quick enough to understand areas like technology, which they really aren't, the drive to deliver care in a way that will be approved, come under regulatory approval, is very strong. So that they do have to play a role. To your point about technology, like the sort of off-the-shelf technology, will transform people's desire to take up home care very, very rapidly, because we're now hearing from some of our local commissioners who are offering something like 40% of all home care they commission as having an element of tech as part of that. And that will lead to smaller number of visits. That will lead to different approaches to delivery of home care quite rapidly. And I suspect, to your earlier points about rurality, that will happen in even more intense ways in places where it's difficult to get the workforce. But if we don't want that, then we have to sort of speak up now, but we have to sort of set out a vision of how we want technology to sit alongside the human element. And I do look at countries like Japan and Singapore and others where they have got much greater use of technology, and their relationship between the human and the technology has to be explicitly stated, I think, certainly at this stage, so that we can, as a society, say yes we want it or no we don't. And if we don't, then back to Donald's point, we have to be putting in the right pay terms and conditions and recognizing what it is that's so special about the human element and paying for it.
And see, it really is about that complementarity, but also a reset. One of our issues,
well, and it's happening so quickly. I think that's the thing. So it's not so for our sector particularly, bringing into the sector the people with the skills and expertise who understand how quickly the technology could and should move, and having that relationship both with the people who provide care, but also the people who are on the receiving end of it, because we get very, very little understanding about what being on the receiving end of technology-enabled care feels like for people versus being on the end of a human delivered care. Now, there's a pros and cons. There's plenty of people who would much rather, from a dignity point of view, potentially have some technology-enabled care rather than a family relative or even at somebody they don't know delivering that care. But then there's other people who, then there are other situations where people really want to be able to talk to somebody and feel human touch. And that's an important part of their connection and engagement with communities and people.
And it really is evolving quickly. We had an expert speaking to us who said the technology of today will not be the technology of 5 years from now. One of the issues we've certainly seen, we lock in on approaches and then they never evolve. I'm really curious as to how do we make sure that we've got adaptable approaches as we look at the increasing demand for social supports. When you think of the majority of the individuals waiting for care at home and wanting to live and wanting to thrive, we've got an opportunity to mobilize. As you think about the future, each of you, what do you hope for? I know each of you really does have clarity of vision. You are inspiring leaders. I think you're like me. You celebrate incrementalism because that's oftentimes the path forward. But you do dream of a different future.
Oh, it's my time to dream.
Your time to dream.
I think, Donna, that the job of people like us is to ensure that long-term care associations are doing the foresight work and the horizon scanning for our members. One of those responsibilities is to dare to imagine beyond the experience of the moment. And I mean by that sometimes our aged care managers and owners and facilities or our home care providers are so busy just to keep the show on the road that they don't have the headspace to do that imagining better work, which I think all of us who are committed to a rights-based, dignity-infused social care or aged care sector are concerned about. So take for the moment, Vic and I have been involved with lots of other stakeholders in a project through Oxford University in developing standards on how you use AI. This technology is changing every day. I read a new article about the whole concept of synthetic resurrection, which means the ability of quite literally creating an avatar and a model of somebody who has died, and what's the role and place of that in aged care with working with somebody with dementia. It raises massive ethical questions. Our space is to imagine a future which is rooted in ethical principles that we can all of us agree with, which has the person and their interests and voice at the center, and which contributes to community and society. In that sense, it's not that difficult. What's difficult is sometimes pulling our sector into a place where it's brave enough to do things differently, because technology doesn't just change in 5 years, it changes in 5 minutes. The way in which we deliver aged care in Scotland today is remarkably similar to what it was 10 years ago. In 10 years' time, it cannot be remotely like what we're delivering today, except the human elements of it.
Vic, when you think about the future, would really welcome your insights.
You won't be surprised for me to hear me say this, but a kind of global aging network where we can share learning between countries. There's amazing long-term care research collaborative that has come out of COVID that is sort of openly sharing lots of data and evidence from all around the world about long-term care. It's getting us to a place where governments look to evidence in other countries and not try and imagine that people aging in their jurisdiction are so dramatically different that they have to start all over again, because we haven't got time for that. I mean, I don't think that whenever I have a conversation with government, I don't get any sense in the UK that there is an understanding of how urgent this is as an issue to address, how dramatically the workforce of 10 years' time will vary from now, not just about the generational element, just about their availability in a significantly aging population. I'm pretty certain that we are the fastest aging population in the whole of Western Europe. We're not acting in that way. We're not saying, tell us the rest of the world what's the best way we can deal with this and address it. I'm getting us to a place where we see aging as a global phenomenon that we need to address across nations, recognizing workforce, recognizing technology opportunities. I'm looking as well to places, parts of the world like India and large parts of Africa will tell us huge amounts about how we can utilize technology in really efficient ways. Countries which aren't dealing with legacy technology and systems will show us just how dramatically we can leap forward to provide meaningful support for people through technology in a way that we couldn't possibly imagine. And we don't need to imagine it for ourselves. We should be talking to colleagues in other parts of the world and learning from them explicitly and recognizing. And Donald has been doing some amazing work with colleagues from the Global Aging Network and United Nations to try and get some proper recognition of the needs of older people. And if we don't do this now, as the demography changes really dramatically over the next 10 to 15 years.
And part of that is that we have to globally address the bias against older people and call out the discrimination, which happens in far too many societies. And that's from the language we use. I'm sick to death of seeing a newspaper or a media headline saying the older age or the demographic time bomb or the age tsunami, all negative images about growing old and aging. We have to see age as a positive state of being. And collectively, we've got to see the potential in aging rather than all the negative.
That's such a great point to land on. And for our listeners, one of the things that we learned through the pandemic is every country made exactly the same mistakes. And no one learned from the other. And yet, coming out of that, relationships and voices and conversations such as this one, we are talking with one another. And there is a global dialogue that's happening, a global conversation where we are challenging each other to learn more about what's actually happening in other countries. So connectivity is an increasing theme about how we connect across systems, how we use technology, and how we talk with one another and push those conversations and challenge our leaders to think differently and to give us the opportunity to be flexible. I often ask, as we think about people retiring, and you've both spoken about an older workforce, globally, how many geriatricians will we have? How many orthopedic surgeons will we have? How many oncologists will we have? And even thinking differently around how we use a global workforce in an entirely different way, where researchers are talking to each other globally. You have this exchange, this rich debate, but at the same time, why can't we be having different conversations about how we use the assets from a global perspective to support one another in an entirely different kind of way? So I'm very excited about the potential of the future. I really want to thank each of you for your leadership. You are a delight to work with and to learn from. And I know that our listeners will find this discussion really enlightening. Thank you for listening to Coming of Age, the podcast that is changing the conversation on seniors' care and aging. We hope this episode brings a new perspective and inspires you to continue the conversation with your colleagues, friends, and family. Be sure to subscribe, rate, and review the podcast so that more listeners will join our community of changemakers in seniors' care. Until next time, I'm your host, Donna Duncan. Keep well. This episode was generously sponsored by our sector champion, Point Click Care. Point Click Care is a leading healthcare technology platform enabling meaningful collaboration and access to real-time insights at any stage of a patient's healthcare journey. Point Click Care's single platform spans the care continuum, fostering proactive, holistic decision-making and improved outcomes for all. More than 25,000 long-term post-acute care providers and more than 1,600 hospitals use Point Click Care today. For more information on Point Click Care's software solutions, visit pointclickcare.com.